PU St. Cabrini School of Health Sciences. So today, I want you guys to learn something new from me because I will be doing a return demonstration about performing a bed bath. So, what bed bath entails? Bed bath is the cleansing of a patient in bed. A complete bed bath indicates that someone must totally wash a patient. This is a bath given to a client who is in the bed and unable to bath him or herself. And now, let us talk about the purpose of performing a bed bath. First, to prevent bacteria spreading on skin. Second, to clean the client's body. Third, to stimulate the circulation. Fourth, to improve general muscular tone and joint. Fifth, to make client comfort and help to induce sleep. And lastly, to observe skin condition and objective symptoms.
Confirm doctor's order. Check client identification and condition, name, age, and birthday.
The bath order may have changed. In some instances, a bed bath may be harmful to a client who is in pain, hemorrhaging, or weak, which is noted to defer the bath. Then, if your client is unconscious or cannot speak, just check the wristband.
Hello ma'am, this is Aliyah, your nurse for today, and the doctor assigned me to perform a bed bath. Are you willing to have a bed bath?
Yes. Providing information fosters cooperation. Encourage the client to assist with care and to promote independence.
Gather all required equipment and bring all the equipment to the bedside.
Organization facilitates accurate skill performance.
In maintaining the client's privacy, you must close the window. Of course, close the curtain or the blinds. After that, make sure that you also close the door.
To ensure that the room is warm and to maintain the client's privacy.
Prepare hot water in 60 degrees Celsius. And of course, pour it into a clean basin.
Water will cool during the procedure.
Don't forget to wash your hands and put on gloves.
To prevent the spread of organism, gloves are optional, but you must wear them if you are giving perineal or anal care.
Remove the client's cloth. Cover the client's body with a top sheet or blanket.
Removing the cloth permits easier access when washing the client's upper body. If an IV is present on the client's upper extremity, Be sure that IV delivery is uninterrupted and that you maintain the sterility of the setup.
Fill the basin about 2/3 full of warm water.
Water at proper temperature relaxes him or her and provides warmth. Water will cool during the procedure.
Ma'am, I will assist you to move near me for you to feel comfortable.
Keep the client near you to limit reaching across the bed.
Ma'am, can you move your head a little so that I can put this towel under your head?
To prevent the bottom sheet from making wet.
Moisten the sponge towel with plain water. And yes, don't forget to make a mitt with your sponge towel.
If you are using soap, be careful about this may irritate the eyes.
Wash the client's eyes. Cleanse from inner to outer corner. Use a different section of the meat to wash the other eye.
Washing from inner to outer corner prevents sweeping debris into the client's eyes. Using a separate portion of the meat for each eye prevents the spread of infection.
Rinse the towel again to avoid spreading of infection or germs. And yes, don't forget to make a mitt with your sponge towel. Wash the client's face using an S stroke. Rinse the towel again to avoid the spreading of infection or germs. Next is wash the client's ears. And yes, don't forget to use the different section of the towel and washing the other ear. Rinse the towel again to avoid spreading of infection or germs. And yes, don't forget to make a mitt with your sponge towel. Then wash the client's neck. Then dry the client's face carefully.
Just a little reminder that if you are using soap, this may particularly drying to the face.
Mom, can you please lift your head again so that I can remove the towel? Move the big towel under the client's forearm.
To prevent sheet from making wet.
Uncover the forearm. Fold the sponge cloth and moisten. Then wash the forearm using long strokes, from wrist to elbow, then elbow to shoulder, then to the client's axilla, and lastly, the client's hand.
Washing the far side first prevents dripping bad water onto a clean area. Long strokes improve circulation, facilitating venous return.
Then dry the client's forearm carefully. Cover the client's forearm and remove the big towel. Move the big towel under the client's near arm. Then, uncover the client's near arm. Rinse the towel again to avoid the spreading of infection or germs. Wash the client's near arm from wrist to elbow, then from elbow to shoulder, and then to the client's axilla. Rinse the towel again to avoid spreading of infection or germs. And then, wash the client's hand. And then dry the client's near arm carefully. Cover the client's near arm and remove the big towel. Mom, can you please turn on your side so that I can put the big towel under your upper trunk?
Macintosh and bath towel A prevent sheet from wetting.
Then put another bath towel over the client's chest. And then uncover it.
Bath towel B provides warmth and privacy.
Fold the sponge towel and moisten. Then wash the client's breast. Rinse the towel again to avoid spreading of infection or germs. Then wash the client's abdomen. And then dry by the big towel covering. And then cover it and remove the big towel. And now, we need to exchange the warm water.
Cool bath water is uncomfortable. The water is probably unclean. You may change the water earlier if necessary to maintain the proper temperature.
Move the big towel under the client's far leg. And cover the client's far leg. Put a pillow or cushion under the client's far leg.
Pillow or cushion can support the lower leg and makes the client comfort.
Fold the sponge towel and moisten. Wash the far leg from foot joint to knee and from knee to hip joint. And then dry the client's far leg carefully. And then cover the client's far leg. Remove the pillow together with the big towel. Move the big towel under the client's near leg. And then uncover it. Put the pillow or cushion under the client's near leg. Rinse the towel again to avoid spreading of infection or germs. Wash the client's near leg from foot joint to knee. And from knee to hip joint. And then dry the client's near leg carefully. Cover the client's near leg. And then remove the pillow or cushion together with the bath towel. Mom, can you please turn on your side so that I can give you a bath to your back and buttocks? And then move the big towel under the trunk.
To provide clear visualization and easier contact to back and buttocks care. Skin breakdown usually occurs over bony prominences. Carefully observe the sacral area and back for any indications.
Cover the back with another bath towel. And then uncover the client's back. Fold the sponge towel and moisten. And then wash the client's back. Dry the client's back by the covering towel. And cover the client's back. And then remove the bath towel. And yes, don't forget to remove the bath towel under the client's back.
Our next step is the perineal care. But then, for my client's privacy, I will not record or video it. Clean the perineal area to prevent skin irritation, breakdown, and to decrease the potential odor.
Of course, assist the client to wear clean cloth.
To provide warmth and comfort.
Make the bed tidy and keep the client in comfortable position.
These measures provide for comfort and safety.
Document on the chart with your signature, including date, time, and the skin condition. Report any findings to senior staff.
Documentation provides coordination of care. Giving signature maintains professional accountability. And that ends my written demonstration. I hope you already knew the importance and the proper procedures of performing a bed bath. I hope to see you next time in my another written demonstration. Once again, this is Aliyah Piayeras, a nursing student from LPU St. Cabrini School of Health Sciences. Thank you